Yes, ma'am.
I'm Carol Scott from the Missouri Child Care Resource Referral Network. I was really glad to hear your remarks about the importance of education in our state, especially as it relates to economic development. Given that most 90% of brain development happens before age 5, I'm wondering what role you see for early childhood education in our state's education system.
Well, I'm a huge advocate of parents as teachers. I think that's a great way to make sure that we are keeping parents included in raising their children and making them understand the importance of that early childhood education to them. So I would support continuing funding of that program. I have 3 boys and have used the program myself, and I think it's an incredible way to keep, as I said, the parents involved, because that is so important for early childhood education and all the way through the rest of education. In fact, this is going off that a little bit, but I was amused at, I think I used this, researched this when I was a state senator. There was a study that the federal government did, of course invested who knows how many millions of dollars in this study to look at how private schools were more effective than public schools, and why that was so. They looked at schools all across the nation and did like a cross-sectional analysis of the different criteria that in a private school versus a public school. And the one thing that they found out and identified, that the reason why private schools were more effective than public schools was, guess what? Parental involvement. Of course, most of us could probably have told them that without $1 million study or whatever it costs, but that's why programs like that, any way we can encourage parents to stay involved in their kids' education at an early age and all the way through is extremely important.
I love your idea that tax policy stimulates the economy, because we see that. But what we're hearing now is that the state economy is not real strong. Revenues are down, and there also seems to be in your own home, the Senate, an unwillingness to be real supportive of tax incentives and tax credits. How do you think you kind of go about dealing with those myriad of problems that we're facing?
Well, that's a good question. And just, you mentioned revenue being down. Actually, we're back on the consensus revenue estimate because there was revenue that came in with the delayed individual income tax returns in May. They were delayed because of the flooding and disaster. And those counties got to, anybody who lived in those counties got to submit those returns May 19th instead of the August 15th deadline. But yeah, you know, there's a fine line you have to walk, because we have to encourage economic development in this state, and economic development in this state expands the economy, and then that creates more revenue for the state. So finding the proper balance, just like in the economy, sometimes you have to go through hard times and work your way through it. But that's why I think some of these tax credits that we give, we need to be careful about how effective and what they're being used for. We want to make sure we get as much bang for the buck as possible from the taxpayers' money when we give those credits. That's why I think it's a good idea to periodically review tax credits and how they're working, making sure that we're getting good price for them, making sure that they're actually accomplishing what they're supposed to be accomplishing. But I think they're also a good tool for economic development.
Jorge Rio Pedro, Hispanic Chamber of Commerce. With the passage of an immigration bill at the end of the last session, do you consider that issue dealt with, or would your administration revisit that issue?
Well, I want to make sure that law works. You know, I've stated before, I think we've talked about it too, that I think employers who knowingly hire illegal workers need a stiff penalty because, you know, it creates an unlevel playing field for those employers who are following the law and hiring legal workers and paying taxes and And so it's incumbent upon the state to make sure that we are enforcing the law. And so I'd like to see how it works and measure it from that perspective. If it's not working, then I think we need to revisit it. Let's see.
My question is that what about any improvements to Medicaid and healthcare, affordable healthcare for middle and to low income people that can't really afford Medicare or health insurance within itself. The guidelines for the poverty level for Medicaid is still struggling, within itself because it's so low that if you're even above $1, you can't even get any kind of health care. So what is your plans as far as improvement? I know Governor Blunt had taken away dental insurance for people that are on Medicaid, for people that are adults, and that's a big issue because if there's a problem like an abscess tooth or something like that, they can't go get it done, and even afford any kind of dental work to even have it done. And then also the issue with doctors and other things not accepting Medicaid because they're taking that away because of slow payments and things like that. What are your plans on trying to make that better?
Well, there were a whole lot of questions in that question, and obviously healthcare is a major issue in the state and what's happened over the last several years. And Governor Blunt did inherit a huge deficit and had to be dealt with. I think we need to go back and review where we are with Medicaid and ensure Missouri did not pass. So, what I'm interested in doing is making sure that we move more towards ensuring that we have a safety net for people who need it, just like you're talking about. Dental care is so extraordinarily important to one's health care, and I think that those are the kinds of issues that we need to make sure we're taking care of for those people who, because of circumstances beyond their control, need that help and that safety net. I also think we need to make sure that next level, those working people who have are trying to hold on to their job but are uninsured, we need to deal with that issue. And I'd be looking for characteristics of a healthcare system that provides more choices, that provides more transparency, that maybe eliminates some of the mandates. I know that Florida just recently passed some legislation where they are offering more of a minimum coverage that doesn't have all the mandates that some states impose on their insurance coverage. So it's more of a lower rock bottom price, and then you can add on, but still provide some of that basic coverage that you're referring to. So I can't give you all the answers. I'm not going to pretend like I know all the answers to this question. I would, as governor, what I would want to do is hear from the people who are affected, and by the hospitals, by doctors, by the people who are providing the care, and figure out the best way to do it. As I said, I look at myself more as a problem solver. I think we should put people in a room and work out the best solution we can to cover the kind of needs that Missourians have. So I'm not trying to sidestep your question, but I hope that gives you a little bit of an idea.